There's significant interest in the clinical utility of cannabidiol. The substance is often used through patients that receive it without a prescription from a psychiatrist. There have been many questions about what are the problems that cannabidiol can help, and we very much need randomized controlled trials to answer those questions. Hurd and colleagues addressed the question about the degree to which cannabidiol might be beneficial in patients with heroin use disorder. And the findings are quite important because they suggest from this preliminary study that there might eventually be a clinical role for cannabidiol. The study shows reductions in both craving and in anxiety in patients that are greater when they are taking cannabidiol as compared to patients who are taking placebo. And this should generate much interest in clinicians to think about when the substance might be more widely beneficial. Along with medications and psychotherapies, new forms of brain stimulation are an additional therapeutic tool that clinicians are beginning to use. Carmi and colleagues use one of these new brain stimulation techniques, deep transcranial magnetic stimulation, and examine the degree to which this treatment might be beneficial in obsessive-compulsive disorder. The findings are unusual in a few ways. One is that we usually think about brain stimulation techniques for their use in mood disorders, and this study demonstrates beneficial effects in obsessive-compulsive disorder. Number two, this is a new form of brain stimulation in that it is able to stimulate relatively deep structures within the brain where we think that there are problems in obsessive-compulsive disorder. So this provides clinicians with new insights about how continued refinements in brain stimulation techniques might increase their utility.